Hi, this is Gopal Punjabi. I'm the Department Chair of Radiology at Hennepin County Medical Center in Minneapolis in Minnesota. I'm showing you the case of an elderly male who presented to the ED with vague symptoms. A CT scan of the abdomen and pelvis was performed. This was done on the ICON spectral CT scanner. And as with all CT scanners, scans done on the ICON, we get conventional CT images. As we scroll through the conventional CT images, we see right away that there are hypodensities in the spleen. And this is where I look at the iodine map, which I'm going to show you on the bottom left as we change it to the iodine map. We're going to zoom up a little bit to look at the spleen and change the windows a little bit. And what we see here is those areas of hypodensity in the spleen show absolutely no iodine uptake at all. So these are splenic infarcts. That's a pretty straightforward call on a conventional CT, but what I'm going to show you next is not that straightforward. So follow the SMA, and you can see that the proximal SMA looks fine. There is, it's just beautifully patent, and you can see the same thing on the iodine map. But as you go down, keep following the SMA, and you come to the distal SMA, and right around that level, even though it looks a little bit bright, there is no iodine uptake within the SMA. So this is a clot in the distal SMA, which would be very difficult to call without spectral CT. I'm going to change the reconstruction of the mono energy level to 40 keV, which brings out the iodine and the lower keV images. And as you follow the SMA again, looks nice and bright proximally. And as you come to the distal SMA, you can see it's completely occluded. That's a diagnosis that would be very, very hard to make on conventional images. Now, we have more information though on this scan. So as we look at the bowel in the right lower quadrant, and we can look at it on the iodine map or on the iodine overlay, which is a color iodine overlay on conventional CT. These loops in the right lower quadrant have absolutely no iodine uptake at all. Now notice these are normal loops of bowel in the left lower abdomen. Generally, the jejunum will have a little bit more uptake of iodine than the ileum, but in this case, you can see the distal small bowel has absolutely no uptake at all. So this is very extensive bowel ischemia involving the distal ileum in this patient who's had a previous ileostomy. But there is more. So patient with splenic infarcts and bowel ischemia, SMA, clot, you worry about an embolic source. So as you come higher and you look at the heart, this patient has had a previous sternotomy and has an aortic valve replacement, also has had a CABG, and you can see the aortic valve, prosthetic aortic valve nicely here. But as you mag up and look carefully at the left atrial appendage, right around there, you can see that there is a filling defect in the left atrial appendage, which shows absolutely no iodine uptake at all. So this is, and you can see it nicely there. So this is left atrial appendage thrombus, which has embolized the spleen and the small bowel and caused ischemic small bowel. Unfortunately, this patient passed away shortly after the scan, but this shows the enormous power of spectral CT, not just diagnosing the problem, but also being a one-stop shop to find what caused the problem. Thank you for listening, and thank you for your interest in spectral CT.